This broadcast will start in 15 seconds. This broadcast will start in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. The Voice of Stockton. For more information on The Voice of Stockton, go to thevoiceofstockton.org.
The views and opinions expressed in the following program do not necessarily reflect those of KXVS The Voice of Stockton or its parents, affiliates, management, and staff.
Stocktonians, and welcome to another exciting episode of Tales and Tips. I'm so excited to have with me today Becky Knodt, and she is the Center Manager for Commnity Medical Center, and we're going to talk about how pivotal this organization is in our city and our county for providing health services for people. Welcome, Becky. Thank you.
Thank you so much, and thank you for having me in your program.
I'm excited that you're here today. So tell us a little bit, for our listeners who may not be aware of what Commnity Medical Center is, tell us kind of how long it's existed and where it's servicing people.
Well, Commnity Medical Center sometimes is a shocking discovery for a lot of people because we are a very well-hidden treasure. We have been in existence since the 60s.
Okay.
We started as a volunteer program from the churches and the public health services, along with the medical society, going into the farm fields and helping people, families that were living under the trees. And they would have no social services nor medical services at all. So this group of wonderful volunteers decided that they wanted to take action, and they will go into the farms and look for these families that were living in cars and provide social services and bring clothes and then bring some food and then medical services because we have the providers on site helping them. Well, the program kind of changed with the time and the need, because the need was tremendous. So then they became a little clinic in a fire station in Balota, Linden. And they were servicing people there at the time.
And Linden, probably in the center of the cherry fields.
Absolutely, with all the farm workers. So they were doing this, and then they decided that they needed some help because the need was gigantic, and they didn't have the resources as much as they wanted to. So they applied for grants and for incorporation as a federally qualified health center with the federal government, and they got incorporated in the 70s, early 70s, 71, I think it was. I'm not sure about the time. But then they became the agricultural workers' health centers. And they were in San Joaquin County. They had a main clinic in Stockton, but they still continue having like portable clinics in the migrant camps, where they were still serving the population that they started with. However, the centers is starting to be not only for the farm worker community. It was a huge demand from the community at large, because the system at the time were providing, the services that we were providing were really a big need for the community as a whole. So then they opened the doors to the whole community. And even if the name was Agricultural Workers Health Centers, they continue to serve the community at large. And we start growing little by little from, as I mentioned, one center in Stockton and 2 migrant camps in San Joaquin County. Then we move into Solano County and Yolo, and we put in some migrant camps out there in Esparto, Knights Landing, and Dixon.
Wow.
So we continue growing, and now we have 16 health centers here in San Joaquin County. And we still have centers in Yolo and Solano County and Vacaville.
How many in the other locations?
In Vacaville, we have 1, Dixon has 1, and Esparto has 1. And for a while, we had some of them in Calaveras County. But we decided it was a little bit too much. So we kind of limited to what we were having before. So we provide a huge service in the communities that we have a presence, especially here in San Joaquin County.
And how many people total would you say that all the centers help a year?
Per year, we see about 84,000 people with about 250,000 visits per year for patients. We have the 84,000 that I'm mentioning. These are not duplicated individuals. These are the total. The 250,000 visits that can be duplicated visits that the patient has. But we provide a variety of services throughout the clinics, and we not only provide health medical services, but we also provide behavioral health, we provide specialty care, and like obstetrics, pediatrics, podiatry, chiropractor, we have optometry, we have, you name it, we have it.
That's awesome. That's amazing. And so someone off the street can just come up and say, I need medical health. How do they connect with you?
Actually, they will have to, they can do that. They can do several things. They can either call and make an appointment, or they can just walk in and they will be helped and will be given an appointment for a future visit. The number to call is 944-4700 here in Stockton. And actually, that will give you a tree giving you exactly the different locations that we have, and they can transfer you to the appropriate clinic that you will prefer to be if it is closer to you. We serve, as I said, the whole San Joaquin County. Here in San Joaquin County, we have almost 9 clinics available, aside from our dental clinics as well. And so they can pick and choose which side is better for them.
Great. And does someone have to have an ID?
No, not necessarily, because they have to have an ID, but the ID doesn't need to be an official ID from the United States. We are talking about people that sometimes come from Mexico, and they don't have a driver license from the United States. As long as they have a government ID from their own country, that would be enough.
Awesome. Do they have to have an address?
Yes and no, because we also serve the homeless population. So because of having homeless being served in our different centers, they could have an address that not necessarily is their address, because we understand that some of them either are in the streets or they are moving from place to place, being with friends or families, etc., without having a house for themselves.
What if they need surgery?
Then we have, that's when the partnerships with the different organizations in the county come into play. We are big partners with San Joaquin General Hospital and Public Health, and also we have a partnership with St. Joseph's Medical Center. And if they need surgery, they will be referred pretty much to the county, because the county is the one that provides all the services for the indigent population and people that cannot afford to pay.
And how do you get funding?
We have different ways of funding. We're federally qualified health centers, so that means that we receive a portion of our funding from the federal government, as well as from medical, Medicaid, grants, the state, because we have a variety of programs. Let me give you an example. When we talk about women's health, we have birth control and family planning services that are provided and funded by the state, as well as we have programs like the Comprehensive Perinatal Services Program, which is for pregnant women that will take care of the woman from the day that they are identified as pregnant until the day that they deliver. And through all those different services that are funded through the state, They will be receiving their medical care, nutrition services. They also will be enrolled into the WIC program, which is Women's Infant and Children program, and they will be helped with the nutrition and food and supplemental food vouchers so they can eat appropriately during their pregnancy. So all these different programs that we have available for the community that we serve are coming from different sources. So funded from the feds, from the state, and from grants.
Wonderful. And what about fundraisers, or what about people donating to you, companies donating to you?
We're trying to do that because we're trying to accommodate more and more people in our services. And sometimes, as you know, especially in the case of people that are undocumented and they don't have where to go, I mean, we have what we call the sliding scale fee, because a lot of these undocumented people are working, and they are working as, your gardener or your farm worker, and construction and cleaning, restaurants,
building.
All these things. So they don't have insurance at all. But we have a sliding scale fee for them based on income. So the only thing that they have to do is to bring their pay stub and tell us how many hours they have worked. We'll figure out in which category they are, so we can put them on those and they can pay based on their income.
So there are some charges for services.
Definitely, yes. This is not totally, absolutely 100% free. The only 100% free are the programs, because we can put them in a program. For example, our homeless program. If we know that that person has no income and is homeless, that person will go into the homeless program, and the homeless program will cover everything. Okay. Now, if the woman is pregnant and they don't have income and and they don't have a way of proving anything, they will be put in the CPSP program, which is the Comprehensive Perinatal Services program, which it will be covered. It's covered by the state, and it will take care of the pregnancy from beginning to end. And then after the baby is born, services will pass to the baby.
Awesome. Excellent. And I know you mentioned the phone number for Stockton. What about a website or a Facebook page?
Absolutely. CommunityMedicalCenters.org is www.communitymedicalcentersaltogether.org. And you will be able to access information about all the different services that we have, the clinics that we have in each area, and the different type of programs that we offer.
And what if someone doesn't have transportation, or do you help to facilitate transportation?
That is something that we are working right now with the Regional Transit District. We are trying to figure out a way, because majority of our people, either they have to get a ride to go to their appointments, or a lot of them, especially in Stockton, downtown, they walk. We have a Channel Medical Center. Half of our population walks to the services.
And I was just smirking because your husband works for RTD. So how great is that? Shout out to Nate Knox.
Yes.
Because you have a connection to try and facilitate the transportation for them. So
and we
awesome.
have been, because that is one of the biggest problems that we have throughout the whole state, to be honest. It's not only our problem, is the problem for all of the people that are living in the Central Valley specifically, because the transportation in the Central Valley is not good. As much as they try, in many reasons, it doesn't have the type of transportation that you find in San Francisco, which is the city, and then you can see, transportation everywhere.
Well, and unfortunately, our city and our county has such a high poverty level. And to me, these services are really important, because otherwise the county hospital is inundated and people will go there when it's an emergency and not have preemptive care at all.
And that is a huge problem that we are actually partnering with the hospitals, doing the transition of care. So what we're trying to build up with this type of partnership is help the people to realize that they can be seen by a provider in our health centers, instead of going to the emergency room, because in reality, if you think about it, the cost of the emergency
So much
room
higher.
is ridiculously high. Not only that, but the
And it's
wait
crowded,
is
yes.
crowded. It's not appropriate. When in reality, you can go to our centers, make an appointment, just like any private insurance, like Kaiser or anybody else. Make a phone call, make your appointment, and go and see your doctor. And if it is an acute issue that needs treatment immediately, we have open appointments, open
Awesome.
access.
Excellent.
So people can make their appointments and come and see us, and instead of going to the emergency room.
And can they make the appointments on the website also, or they have to call to make the appointment?
No, they will have to call to make the appointment, because right now we don't have access at the web. We're working on all that. We're coming with times. We have been a little bit behind on that one. But what we are also doing right now is we have a portal. So every patient that registers with us and is our patient, they can register themselves in a web portal, and they can do like with the other private insurance. You can go in the portal, make your appointments. You can see your tests, your labs, the results.
Awesome.
Everything, just like any
Just like
other
any other-
big shot insurance
Great.
company, but you have to be a patient to access that portal.
Of course. And we didn't talk about like days of the week and times of services.
Absolutely. Okay, majority of our services are Monday through Saturday.
Wonderful.
We are open. Not all the clinics are in the same line, but the majority of us are from 8 to 8.
Wow.
And
That's
in
amazing.
Fridays, some of them are 8 to 6. Channel is 8 to 8. And then we have Care Today, which is a kind of like urgent care. It's not an urgent care because we don't have the services that an urgent care will have, but this is for people that really need to be seen. And if there is no appointments, they can show up there and they will be seen. And they are open from 9 to 9. And they are open Monday through Saturday as well. And in Saturdays, our regular health centers are open from 8 in the morning until 4 in the afternoon.
Wonderful. And how many doctors would you say do you have working for your
boy.
organization, roughly?
Roughly, I will say, really about 30, 35
Oh,
providers.
I thought you would say more. Okay.
Maybe more. I'm sorry, you caught me by surprise
Okay,
on that
that's
one
okay.
because it has to be more. I'm
It has to
sorry
be
because
more.
I have
Maybe in
only
Stockton
my
that many.
yes, only in my health center I have 11.
Okay.
So,
it has to
if
be way more
multiply
than
that by 16,
Okay.
yeah, that's about 66 doctors
That makes
or
more
so.
sense.
Yes.
All right.
Yes, absolutely.
And I'm most familiar with the facility at Gospel Center Rescue Mission at the Gleason House.
That's our pride and joy.
That's an amazing, amazing, beautiful facility. And I partner with them with my vaccine clinic for the animals of the homeless quarterly. And it's a beautiful facility. And we're very fortunate to have that there. And it serves such a huge need in our community.
It is, and that is actually the base for our homeless program. Our homeless project started right there at the Gleason House, and in very strong collaboration with the Gospel Rescue Mission.
I was going to say that my husband was part of the founders of that facility.
Right.
Shout out to William Brown, and also shout out to Randy Pinelli, who runs the
Absolutely.
facility.
And these guys are phenomenal. With talking about Randy Pinelli, he is a provider that goes into the community under the bridges in the street to him and his team, because he doesn't do it alone. He has a team of people that goes with him, provide medical services,
And
enroll the people, and do dental services, dental clinics. They do and behavioral health, and then they try to bring them into the clinics. And
Yes.
the Gospel Rescue Mission is an amazing site that also provides such a great help to the community.
And try and get them off the street.
Absolutely.
And a step up so that they can change their lives.
Absolutely. And one beautiful thing that they have come out lately with is the recovery center, where a person, because a homeless doesn't have a home to go back after they are in the hospital and they have been treated. So Randy and your husband work into that program of having, I think they have 9 beds now.
I think it's more. I think it's grown. The respite
It
they
started with
just got
9
more
beds.
Yes, it started,
with 9 beds.
and I think it's 16 now, but
Oh,
I don't.
wow.
I'm not positive on that.
I'm not positive about the number. I remember it was 9 when we started it. And so they could come and recover there and get the
great.
treatment and medications and everything that they needed instead of being in the streets.
And the hospitals love it too. It's a win-win partnership.
Absolutely. Absolutely.
And we should also give a shout out to Wayne Richardson, who now is the new director for over a year, and he's carrying on where Bill left off, and has done some amazing transformations at Gospel Center Rescue Mission. And also Dennis Butner, who leads the teams going out into different parts of the community to try and reach out to people that need help.
That's correct. Those guys do a job that nobody have any idea how they do it. And they are totally oblivious of how people are helping people in such a ways that nobody's aware of. There is no commercials, there is no media, there is nothing. They do it with their heart.
I should
and
bring
their
Dennis
dedication.
on here. We should have him
I
talk.
know, that would be
He can tell some
fantastic.
amazing stories, I'm sure.
Absolutely. I can imagine that.
I don't know how he stays motivated to do what he's doing, because he sees the tragedy that people go through on a daily basis.
I agree. We should bring Randy and him
Yes,
together.
that would be awesome.
That would be awesome because they can have
I'll tell them
amazing
you
stories.
said that.
Please do. Yes, absolutely. I agree.
No, that would be a great conversation.
It's a wonderful program, and we are so proud of having that at community medical centers, being part of what is part of what we believe, which is to provide services and wellness in the community.
And part of
that
the
we serve.
solution.
Absolutely.
So-
That's what we're trying to do.
Let's talk about what events that you guys have separate from the medical health. Are you having fundraising events?
We
or
are having
awareness
one
events?
right now that is going to be a lot of fun. It's going to be on August 24th, and it's a big fundraiser. It will be at the University Plaza Hotel.
Awesome.
Yes, and so we are really looking forward to people to come and join us and have fun. It will include the cocktails and dinner and a big dance after that, and it's $100 a person. And so I'm really, really looking forward to the event because it's called the 60s and 70s Saturday Night Fever. And the reason that we did that is because, as I mentioned before, we started this program or this organization in the 60s, and we incorporated in the 70s. Awesome. So we have a celebration that is also 40 and 50 years of existence in our communities.
Wonderful. That's awesome. That sounds amazing. And we'll have to keep promoting that. I'm sure Nate will promote it on his show too.
Oh, absolutely.
But that's magnificent. And you must have, so there must be live music as well.
Live music is going to be a wonderful dinner, if you know the University Plaza, the surroundings is a beautiful, beautiful area to have a
It's in the ballroom?
I think it's going to be outside.
Oh, that's
I'm
even
not totally
better.
sure.
My Rotary Club does an event out there. We do a luau, and it's a wonderful location.
Beautiful.
It's beautiful.
And we
Awesome.
took the idea from the Rotary.
All right. Awesome.
Yeah, and the luau. Yeah,
Excellent.
absolutely.
No, that'll be great. So let's give the details one more time. The date and what time is it? Is it from like 6 to 10?
6 to 11. And it's going to start at 6 o'clock. First, it's going to be an hour of cocktails. Then the dinner will be served at 7. The program will be at that time. And then from 9 o'clock, 9 o'clock on will be the dancing.
And that's a Friday.
It is a Friday.
All right. And tickets are $100. Friday, August 24th.
Yes, actually, I have a flyer in my purse. I should.
Great. Yes,
get
we
it to
should
you.
keep that here so we can keep promoting it. And how does someone buy tickets?
They can. They can call me. How
Great.
about that?
How do they
I can
call
get
you?
them.
Great.
Call me at 209-482-6918 or text me, and I will definitely get you a ticket.
Wonderful.
I would love to
Awesome.
sell as many tickets as possible.
Wonderful. That sounds like a great event.
It is a great event. It's gonna help us a lot because what we are doing for this is we're fundraising for our Reach Out and Read program, that we do with all our patients.
Oh, okay.
All our pediatric patients, we receive, we're partners with Reach Out and Read program in the state, but it also is going to help us with our dental hygiene
Great.
program that we do outside for the homeless community.
And are you going to show any like slideshow or video presentation?
Absolutely. We're
Wonderful.
going to show you the story, a
Great.
brief history of the centers, and how it
Wonderful.
have mutated from what we were to what we are.
Transformed. And you're transforming
Transformed.
people's lives, so that's perfect.
And we are so proud of that. We're very, very proud of that.
You should be. And that's amazing to hear the number of people that you're servicing in our community. And really, truly, you are helping the hospitals as well because you're decreasing their load from things that don't need to be seen there.
Absolutely. It's a help, like you say, it's a win-win situation because not only we're helping the patients and to have a better quality of life and getting multiple services instead of one thing that they went to the emergency room for to be treated. Now we can identify what the real source of the problem
Underlying
is and the
issues.
different treatments that they may have, but also take away all the burden for the emergency room in the hospitals.
That's huge.
Which is huge. It is.
That's huge. And are you looking for sponsors for that gala that you're having?
Absolutely. If anybody wants to sponsor us, there's still time for that.
Great.
And
And they can call you.
they can call me
Go ahead and give your number again.
at 209-482-6918.
And what about raffle items or silent auction items?
That would be good too.
All right.
So anything that you want to donate for that, if it is we're going to have a lot of fun, and I think it's going to be a beautiful, beautiful event.
Awesome. And I know you talked about having, for example, a facility in Dixon, and you have facilities in other places that are not in our county. How do they work together? Do they all offer the same services?
All the same services. We're standardized. We have the same services with exception perhaps of the dental clinics. We have all the other services in our clinics in Esparto, in Vacaville, and in Dixon. So all the same services.
And the doctors that are working for you, are they working for you full time? Do you also have doctors and dentists that are volunteering?
We don't have volunteer providers.
Okay.
They are all working directly with us.
Okay.
Yeah. And now we have a new program that I need to share with you.
Yes.
Well, we have formed a partnership with the St. Joseph's Medical Center, and it starting in July 1st. Now, Channel Medical Center, the downtown clinic, is having a family medicine residency program in our site.
Oh, that's amazing.
It is. So we are building, teaching, grooming the providers for the future.
Wonderful. And then hopefully they'll stay here.
That's the key right there. It is very hard to recruit providers, especially family medicine. And so what we're hoping is that with this partnership and this work that we're doing with St. Joseph's, we are going to be able to keep some of these doctors with us because these are already doctors. They are just doing the residency to finalize their degree. So if some of them decide that they like to work with the community, we will have them with our arms totally open.
Wonderful. And if there's any doctors listening or anyone that knows a doctor, how can they connect with Community Medical Center?
Hey, call me. Anything, call me, because I don't want to give you the run around with a bunch of numbers that are going to be confusing. I can direct you exactly where you need to do,
Great.
what you need to do, where you need to go, etc. So
Great. Go ahead and give your number again.
209-482-6918.
Wonderful. And tell us a little more about the residency program. How long does that go on for?
Okay, it's going to be 3 years. These are, the program just started with us on July 1st. And these providers are between St. Joe's and us. So they are doing, and they're studying their classes. and as well as the practice at the hospital and practicing in our clinics with our patients doing family medicine. And they have preceptors that are with them, so they are not just on their own providing the services. They have a teacher that is a preceptor that is seeing the patients with them. So actually, it's a convenient way for the patients. It's a little bit more dedicated service. They don't see the same number of patients that our regular doctors do because they are learning. This is
Takes a little longer.
Takes a little bit longer. So they have only not only the resident but also the preceptor seeing the patient and looking at the different issues that the patient may have. So it is fantastic. They come to our center every Wednesday. So they have a whole day with us. And then the rest of the week, they are, as I said, in class or at St. Joseph's practicing with the hospital.
Awesome. And how many residencies will be available?
Well, right now I have 6.
Wow, that's excellent.
Yeah. Because they are also there is 2 sets of residents. One are for family medicines that are with us at community medical centers. And the hospital has another set of residents that are doing emergency medicine. So they are in the emergency room at St. Joe's practicing
So
over there.
there's 12 or there's 6 total?
No. It's 6 for me.
Okay.
And it's 12 total.
Okay,
but
great.
they are not going to be exchanged. And then these are growing. So at the end, we're going to have next year, we will have 12. And then the year after, we will have 18.
Wonderful.
So it's going to be huge.
Wonderful.
And
That's
this is
huge.
It's huge.
And that's especially important because it's anticipated that we're going to have a shortage of doctors in our area, especially as people are retiring. So that's wonderful if this can be feeding into the doctors that hopefully stay in our community.
We already have the shortage at this point. It's so hard. This is so interesting because I was talking to my doctor, and he said, "How are you guys doing to recruit?" And this is I have private insurance. So this is my private insurance carrier that is asking me and saying, how are you doing it? Because we are having a heck of a time recruiting doctors. And this is, again, I'm going to say it is Kaiser. Okay, so Kaiser is having a hard time recruiting. And I said, well, join the club. It is. Everybody is having the same hard time. He goes, it's so difficult. It is. We have to do miracles to try to bring people, especially in the Central Valley.
So what are some other things that you think that we could be doing to recruit doctors to our area? What does your company do as an incentive besides the residency program?
we have a lot of incentives to the providers to come and work with us because we have a repayment program for their loans. And as you know, that the doctors come out of school with like gigantic loans. I mean, they are set up for the rest of their life being paying for their loan. And Community Medical Center has a program where the providers can come and work they have a contract for 2 years minimum. And if they work for 2 years, the company will repay their loans.
Wow, that's amazing.
On top of paying them.
That's amazing.
As regular doctors. So it's a great system, and we're trying hard. Not very many people want to come to the Central Valley, but we have a few of them that they are in the program right now.
That's pretty amazing that you offer that. And I know that it used to be that if you would travel to different areas where there were shortages of doctors, that they would do a similar thing.
Correct.
But I think that's amazing that you're offering that. And again, the more doctors we can get to come to our area, then the better care.
Will be.
Yes.
The better will be as a community at large. Yes.
And I love the idea that there's 2 opportunities with the residency for general practice and also for emergency care. So if any of these clients call you after hours, then they're directed to go to the county hospital, correct?
No, depending on what the call is. If they're calling because there is an urgent situation, yes, definitely they're going to be directed to go to the hospital. If it is something, we have doctors on call after hours.
Wow.
Yes.
I didn't expect that. That's amazing.
Yes, we have rotation of doctors that are on call. So the service that we have, the after-hour service, will take immediately the number, the person, and information, and call the doctor on call, and they will be returning the call if it is not an emergency.
Wonderful.
If it is an emergency, as I say, yeah, definitely you go to the ER.
Okay. And then with county ER, how does that work if someone can't afford care?
County has the same as we do, some programs that they can enroll the patients on, or they are going to, they have social workers also, community enrollers, like we do. We have a whole set of people that dedicate themselves to look into what the person that is in need could be put into, in what type of program, what type of system, what type of insurance. The county has the same thing. So if the person is in need, the county will be able to enroll them into medical, Medicaid, or whatever it is that they qualify for.
Okay, excellent. All right. And anything that you'd like to talk about that we didn't cover?
Well, aside from the medical services, as I mentioned, we have a variety of specialties. And one of the things that we have that I think is very crucial for any person is not only the well-being of the body, but also the well-being of the mind. And one of the things that is very needed in this county, and it has been needed for a long time, and we struggle because before we couldn't find the professionals available to work, is the behavioral health and the social services. And we have a good, wonderful set of LCSWs, licensed clinical social workers, and also psychologists working for us. And we provide these amazing services that before were not available to our services, our clients, our patients. You will have to refer them to mental health and not being able to deal with them directly as we do now.
Wonderful.
And we have a big team of these providers that are completely loaded with all our patients. So, as I said, we have a variety of services, and I can tell you, and also in our clinic, for example, in downtown Stockton, we have pharmacy, we have lab, we have x-rays, we have chiropractor, optometry, podiatry, physical therapy, dental hygiene, and pediatricians, obstetrics, and family medicine.
Wow.
So aside from the different programs as the WIC, nutrition, CPSP, behavioral health, and early intervention services for HIV.
That's awesome.
Yes.
So basically everything that anyone could need, you have some way to help and give support.
Absolutely. Now, not all the clinics have every single service like we do at Channel. The reason that we do it at Channel in that way is because we are the oldest one and the biggest one.
And where is Channel located? You keep
Channel
mentioning
is located at 701 East Channel Street in the corner of Stanislaus and Channel.
Okay.
But we have a clinic in Hammer Lane. We have another clinic in Manteca, in Tracy, in Lodi, and we have in Mariposa Road. We also have the Care Today, which is in East March Lane. And so we are all over, really, the county.
That's awesome.
So people can access all these
And they
different
can
services.
call that main number, and then they'll connect them to the clinic that's
exactly
closest to them.
Yes, because there is a tree that will tell you if you're calling for Hammer, this is the number, press 1 or 2 or 3 or whatever.
Wonderful.
And they will pass them to the appropriate clinic.
Great. That's excellent. That's just amazing. And like the Lodi Clinic, do you have an idea of how many people that serves?
At this
In
time,
comparison.
I cannot tell you exactly how much, but because I don't remember all the numbers for every one of them, I should have brought my little cheat sheet with
all
me,
good.
but I didn't do. But the biggest ones providing the most services are Channel, Lodi, Tracy, and Manteca. Those are the 4 locations that have the biggest numbers. Now, we're building a new clinic in West Lane because Hammer is already exploding in people and they don't have the space. So we're building a new one that is going to be huge. It's going to be even bigger than Channel.
Wow. Where on West Lane?
It's going to be West Lane and Hammer in the corner where they have a shopping center there.
Okay.
So it's a huge... It's
By Costco?
Uh-huh.
Cool.
No, across the street.
Okay.
And so it is going to be gigantic.
Wonderful.
And it's going to be able to serve a lot of population in that area that really need it. It was so needed. So that's the reason we're building
Excellent.
it. And hopefully, because of the residency program coming to Channel, that is going to take over with the number of providers that are going to be there. And year 3 is going to be 18 of them. We need to build another one. We need to move out of that one, leave that for the residency, and then get our own. We're growing. We continue to grow, and
The need grows.
the need is so big.
When is the estimated time that the one on West Lane will be open?
I think the estimation is in October.
Oh,
Yeah,
This
pretty
year?
soon. Yes. this
wow.
year.
That's wonderful.
Yes.
That's huge.
Estimated time. So we'll see if it is true. But yeah, we're hoping for October.
Okay. And we talked a lot about the population that you serve. We didn't talk about veterans. Do you serve any veterans?
Absolutely. We have a lot of patients that are veterans throughout all our system, throughout the whole county. A lot of them also go to the Gleason House because they are, as you know, traumatized by the experience, and a lot of them
PTSD and other
PTSD,
issues.
exactly. And they end up. This is the saddest thing in the world, but we do not take very good care of our veterans here, and we don't provide the services as they should. I mean, yes, there is a veterans clinics around, but they are so isolated. I mean, like I think we have one here in French Camp, but the next one is in Livermore. And how many people has transportation or place to go, especially if they are going through some trauma and they cannot even function at the time.
And the one by the French camp is small. It's supposed to
Tiny.
be rebuilt for the past 6 years. It hasn't happened yet. Groundbreaking keeps getting pushed back. It was supposed to be this year. Now it's going to be next year or so.
And it continues like that, and it has been like that forever. So it's so sad because then our veterans a lot of them are in the streets. They're dealing with drug abuse. They're dealing with homelessness. And we are so happy that we can provide a little bit of services for them because they are all the ones that can, our services are available to them as they are for everybody in the community. But the beauty is also we are going to be having, aside from our behavioral health services, which are helping already our veterans, we are starting a new program pretty soon, and that is going to be dedicated. It's a sovereign program.
Oh, that's wonderful.
Yes, so it's going to be helping
Wonderful.
also with substance abuse. And so we are trying to, because of that, we're growing. So we're growing so much because we're trying to serve the community and the person as a whole, from beginning to end, from the mental side, from the substance abuse side, from the body and physical well-being. So we keep growing because of that. But yes, we provide services to our veterans.
And I was trying to look up a phone number. Dignity's Alcove, a friend of mine, Julie, shout out to her, runs. And I was looking for a phone number, and they house veterans.
Correct.
I'm going to give a number, 513-2038, if there's any veterans that are in need of housing. We also have Disabled American Veterans Charities, Catholic Charities. So we're fortunate that we do have a lot of organizations that are helping our veterans. But it's true that we do not take good care of our veterans.
And you know what? We are lucky here in San Joaquin County because we have, like you mentioned, all these different organizations that they are trying to help. And they are really trying to take
Yes.
care of the veterans because they see the need, they see the importance of taking care of the people that sacrificed their life for us.
Yes, they
So-
made the ultimate sacrifice. Our freedom
Absolutely.
is not free.
Exactly. We have the freedom that we have thanks to them. So we need to really do a better job. We are trying in some ways or form, but we need more than that.
And then I also want to give the Veteran Suicide Hotline number is 1-800-273-8255. That's 1-800-273-8255. Unfortunately, a huge number of veterans on a daily basis are committing suicide. And in as many ways as we can intercede, we need to be able to do that.
And it would be so important if the people get learn about all these things. But because the thing is that I don't think the majority of the people in our community realize the importance, the big need that we have for our veterans. Because I think if everybody knew what is going on, like you're mentioning, all the suicide that happens because of the PTSD, they will be definitely trying to help and trying to get involved to do something for our veterans.
And the need is great, just like the need is great throughout our population for healthcare. But yes, as you said, I mean, here's a population of people that have been willing to make the ultimate sacrifice, and we should be taking better care of them.
Absolutely, 150. Yes.
Right. Any final things that you'd like to add?
Well, actually, what I would like to say is that people need to be aware or learn a little bit more about the different services that you have in your community, because a lot of many times you think that you are alone and you think that you don't have a place to go. And there are places to go. There are services that can be provided to you. You're not alone. And you can access some of them for free. Some of them, yes, you will need to have a medical or Medicaid or some type of help. But if you don't have any insurance, you still have services available to you based on your income, if you have an income. And if you don't, we will figure out a way of putting you in some program.
That's awesome. That's awesome to know that there's help available for everyone.
Absolutely. And the thing is that you just need to know. You just need to, the biggest job you have to do is to search, and you will find. Because a lot of people say, oh, there is nothing for me. Oh, I don't have money. I don't have insurance. I don't have where to go. And sometimes we ask, have you searched for it? Did you ask other people? Did you go to an agency and say, where can I find this help? Because a lot of the community-based organizations are aware of the services that we each other provide. So if they don't have it, they will refer you to. They will tell you, go to this place, go to the other one. You have to do a little bit of work by trying to find out where to go, but there are services available in our community. We are really lucky.
We have a lot of amazing organizations, and that's part of why I love the radio station, because we can highlight the things that are available. I wish that we had some central website that showed, okay, if you need housing, you can contact here, here, and here. This organization does X, Y, and Z. Health-wise, your organization does this, this, and this. And
I don't
they
know
reach
what
you by
happened,
this.
but a couple of years ago, we had the 211
Yes.
number.
Yes. 211 is awesome.
The 211 is fantastic because you call 211 and they
Senator
can give you...
Galgiani set that up for us.
Exactly. And the 211 is like the 411 information, but this is the information about the different organizations
In
that
different
exist.
languages.
Absolutely. It exists that can give you information about where you can go and where you can access the help that you need.
Yes, we still have that. That still
Yes.
exists. And it's a great organization. It's a wonderful, wonderful help. But it would be nice if we had a website where you could see this group does this, this, and this, because I think it would make it easier.
You're so right, because we are in a different age. It's not only the phone now; it is also accessing the information with the websites, and so being put in all the. Maybe we need to think about that.
But let's repeat all your contact information so
Well,
that people can reach out that are in need.
If you need an appointment, if you need services, call the 209-944-4700. and they will connect you with the appropriate clinic, appropriate service of community medical centers in this county, and also, as I mentioned, in Solano and Yolo. If you want to donate, if you want to be a sponsor for our event, or if you want to buy tickets for our Saturday Night Fever event, then
That's on a Friday.
oh yeah, that's right. Call my number is 209-482-6918.
And that's Friday, August 24th at the University Plaza from 6 to 10.
Correct.
Tickets are $100.
Yes, or you can buy a table for 8 for 800.
Awesome.
That would be fantastic.
And your website?
My website is www.communitymedicalcenters.org.
And do you have a Facebook page?
Yes, Community Medical Centers.
Awesome. Excellent. And it's been so amazing having you here. Thank you so much, Becky, for coming out.
Thank you, Julie, for inviting me.
It's amazing to hear all the wonderful things that you're doing to help not only our city and our county, but beyond.
Well, it's wonderful that we have people like you that invite us over so the secret can be spread out.
Yes.
And
We
the
don't want it
people
to be
can
a
access.
secret.
No, we don't want to be the best kept secret. Somebody told me that some time ago when I was talking about the different services, and I was doing an interview, and he goes, "Oh my God, you are the best kept secret in this county." And I said,
But we don't want it to be a secret. We want people that are in need to be able
Absolutely.
to access the services that they need so that they improve their health and their quality of life. And we all win with that.
Absolutely. It's for us as well as it's for them, and it's for the future of our children.
Yes, yes. All right. And I'm going to go ahead and sign off. I am the voice of Stockton. You are the voice of Stockton. We are the voice of Stockton. Let's make it a great day.
Great.